are the Community Access Program nurses. I'm Charlie Woods. In the middle, Melissa Hamlin and Anna Patrica. And we are going to go over the updated November 2017 version of the state's Health and Wellness Guidelines. So the Health and Wellness Guidelines, they are guidelines that provide the tools necessary to advocate for the best possible medical care for people with intellectual disabilities. In the Health and Wellness Guidelines, there are 25 standards. The standards are requirements for some or all individuals receiving supports. One of the first things we want to talk about are the variances. Variances are circumstances which may indicate the application of a standard may not be in the best interest of the individual. When a variance occurs, there must be discussion between the individual, the healthcare provider, the support team, and the guardian. There must be documentation of this discussion.
So standard one for the emergency fact sheet is where we start with this. Pertinent client information regarding medical information, including allergies, medications, and medical problems. There is a change in addition to the emergency fact sheet regarding protocols for emergency treatment, and also to have the advanced directives attached to the emergency fact sheet. Emergency protocols, for example, could be if your individual is requiring diastat for emergencies and those type of things. Also, emergency fact sheet should have the individual's name, address, phone number, date of birth, and marital status. The guardian's name and contact information, insurance information, as well as the healthcare provider's name, phone numbers, and specialties. Medical problem list, if the individual has any known allergies, a list of current medication with dosages and purpose and times of administration need to be on the sheet. Protocols for emergency treatments and advanced directives, as I had mentioned previously, that is a change. Diastat, EpiPen, rescue inhaler, those type of things should be listed there, what to do in those cases. And the date of your last physical and dental exams is a new one that needs to be on the emergency fact sheet. The last dental exam, the date of that, and tetanus immunization. Other interested individuals, for example, friends, relatives, or providers are also listed on the emergency fact sheet. Other individual pertinent information like the preferred communication method, ambulation needs, and dietary needs. The date of the emergency fact sheet when it was completed needs to be on there. Okay.
Standard 2, medical consent. Consent from the individual or his or her guardian is required prior to medical treatment, proposed changes or additions to medical regimens. The service coordinator needs to notify the guardian when tests are ordered or new medications are started. Standard 3, incident reporting. Critical event incident reports note unusual or unexpected medical visits, emergent care, significant medical events such as death, hospitalization, medication errors, significant injuries, or chemical restraints. Critical incident reports are sent to the Division of Developmental Services. The state must be notified within 24 hours by phone. Standard 4, restraint procedures for medical purposes. Physical, mechanical, or chemical restraints may be used for medical purposes on a time-limited basis. Physician order must be included to utilize a restraint for medical purposes. Reorder of restraint must occur every week, and evaluation of that restraint is needed.
And standard 5, universal precautions. Training must be provided in accordance with OSHA requirements, and this standard applies to all agency employees. Standard 6 is the hepatitis B vaccine. For individuals receiving services, each person's primary care physician should evaluate his or her risk for contracting hepatitis B. Individuals receiving services in a group home must be offered the vaccine without any cost to the individual. Standard 7 is the annual physical exam. The annual physical exam should include the physician's name and their signature, a complete medical problems list, a body systems review with blood pressure and weight, complete list of prescribed medications, which is meant to include over-the-counter medications, a list of lab, diagnostic, or cancer screening tests that have been ordered. Also, any physician recommendations, a copy of the annual physical and a list of any labs and testing ordered at the visit should be in the shared living provider's file in the home.
Standard 8, in regards to dental exam. Semi-annual dental exams and cleanings, or as specified by the dentist, are performed as recommended by the American Dental Association. The date of the last dental cleaning or visit needs to be in the emergency fact sheet. A copy of the report of the exam and cleaning needs to be obtained for the chart. Standard 9 is in regards to medication prescription and administration. All prescription meds reviewed annually by the provider. Over-the-counter meds are also approved by the practitioner or provider. Diagnosis for which med is given is documented. PRN or as-needed medications like Tylenol, for instance, are specifically prescribed. Administration, so all medications must be administered as defined. Med sheets must be used. Medication errors are documented by event reports. PRN medications must include documentation of the time, dosage, reason, and the effectiveness of the PRN. Prescription PRN meds require medical assessment. For example, lorazepam for a behavior, that would be an event report, and we would want to follow up with that. Psych meds, behavior support plan, and event report. Continuing with medications, the shared living provider must have a medication administration training. Documentation of employee training is required. Ongoing monitoring is required, such as tracking of meta errors, review of doctor's orders, and regular monthly checks of medication sheets. Self-medication of any individual who indicates the desire and possesses the capabilities may administer their own medications. They must first be assessed by a nurse or physician, and then competency should be reviewed periodically.
Standard 10, immunizations. Immunizations are maintained in the individual's file with current dates. A tetanus is every 10 years. Measles, mumps, rubella, anyone born after 1957. Flu annually for recommended individuals, and the pneumococcal recommended individuals. Hepatitis status. Standard 11, psychiatric services. Psychiatric assessment and treatment will be available for individuals with known or suspected psychiatric disorders. Licensed psychiatrists or psychiatric nurse practitioners will provide assessment, diagnosis, and treatment of psychiatric disorders. Standard 12, vision, eye health care. An initial comprehensive eye examination must be obtained and documentation thereof filed. Children need re-exam only if symptoms or injury occur. Puberty to 40 need re-exam only if symptoms or injury occur. 40 to 64, optometrist decides the frequency. 65 or older, every 1 to 2 years. Diabetics must be examined annually.
Standard 13, neurological services and seizures. An evaluation by a neurologist is required for individuals who who are initially prescribed seizure medication. Seizure records must be kept, and a complete seizure record includes the date of the seizure, the time, what may have happened prior to the seizure, description of the seizure, the time frame of the seizure, and what the post-seizure status of the client is. Standard 14, orthopedic services. An orthopedic evaluation is required for individuals with musculoskeletal disorders, neurological dysfunctions, and other related types of disease, injury, or illness. Documentation of the initial evaluation and subsequent examinations is maintained in the person's file. Standard 15, occupational therapy and physical therapy services. Occupational/physical therapy services are provided as necessary and referred by the primary care physician.
Standard 16 has to do with hearing and hearing aids. A professional audiological examination is obtained if indicated by a physician screening or by signs and symptoms of a hearing impairment. Standard 17, lab and other diagnostic testing. Baseline testing must be obtained, and this could include CBCs, LFTs, blood chemistries, glucose, etc., as determined by the PCP. Medications requiring blood level determinations are checked on a regular basis and as per order of the following MD. So there are some changes to the cancer screening ages and for men and women. And we suggest that you go on to the American Cancer website. What is it called, Anna? American Cancer Society. But I can go through the changes here. So for men, colon cancer screens for men and women 45 and over, or as directed by the MD. For males, they should have a DRE and a PSA at age 50, usually done at the annual physical. For females and cancer screenings, mammograms, one before 40, and then every 2 years between the ages of 45 and 54, and then yearly at 55 and over, or as directed by the physician. As far as PAP testing for women, it would be 21 to 29 would be the starting age is 21, and then you would have them for every 3 years, and then at the discretion of the MD, as long as you don't have any abnormalities. The co-testing would be from 30 to 65, and that would be every 5 years, the PAP and HPV screenings. 65 and over are only as recommended, or if you have a pre-existing condition. And as I said, please refer to the American Cancer website as changes do occur frequently. Other lab testing may be indicated by type of medication. For example, seizure medications like Dilantin, Depakote, or Neurontin. Seizure medications which need therapeutic blood level should be tested at least annually and more often as indicated. Psychiatric medications like lithium or clozaril. Lab studies are indicated for these and others due to side effects and can only be detected by blood work. In any instance where blood tests reveal out of range levels, immediate follow-up is indicated.
Standard 18, prescribed nutritional diets. Any diet started to address a specific medical condition, such as weight loss, allergies, hypercholesterolemia, must be prescribed by an MD or a registered dietitian. Any and all support team members must be aware of these dietary restrictions. Standard 19, weight and Menses charts. Weight records are implemented and maintained when indicated by the physician, diagnosis, or by symptoms. A record of Menses is kept for women if a need is determined by the physician. Standard 20, adaptive equipment. The need for adaptive equipment is evaluated. Adaptive equipment is obtained as necessary and is properly maintained.
Standard 21, my favorite, special care procedures. By definition, a special care procedure refers to a nursing procedure that a layperson without professional license does not typically have the training and experience to perform. If a client has a special care procedure, it needs to be included in their ISA and must include the procedure name, the nurse providing the training and monitoring of that procedure, and the frequency of review and training from that procedure. The nurse's role is evaluation of the individual performing the procedure and formulation of a special care procedure plan. The service coordinator is responsible for notifying the registered nurse if they believe an individual needs a special care procedure. The service coordinator must include in the individual's ISA a special care procedure plan. The individual's file in the home must include the procedure taught and the training record. Special care procedure nurse's role. The nurse will evaluate the need for a special care procedure. We will establish and train the special care procedure, including primary caregiver and any respite providers. And we will provide a record of who did the training, when it occurred, who was trained, and when retraining will occur.
Standard 22, Advanced Care Directives and Planning. As an individual's life progresses, or if there is a change in a person's health condition, opportunities for discussion with the individual about advanced care planning should occur. All documentation pertaining to the Advanced Care Directive must be maintained in the individual's file. Standard 23, Training for Support Workers. All support workers, DD and SSA employees and contractors or subcontractors need appropriate training. Training must be provided in accordance with the regulations implementing the DD Act of 1996, Part 10.
Standard 24, alternative or complementary therapies. The primary care physician must be consulted prior to the initiation of alternative complementary therapies. Standard 25, tobacco use. Individuals will receive services in a smoke-free environment unless they choose to smoke. If a person uses tobacco, education about the dangers of tobacco use will be provided.
That concludes our review of the health and wellness guidelines. Thank you very much.